Good morning, everyone. How are you? It's a great day, isn't it? I'm Angela Wheeler, Chief of External Affairs for the Baltimore Museum of Art, and I'm excited to be here with you today. First and foremost, I want to thank you all for your support of the BMA, and without you, there is no home for great collections in Baltimore. Coming together to hear insights today and to witness this powerful and moving installation created by the acclaimed artist, activist, LaToya Ruby Frazier. Let's give her a hand. Now, a little bit about her work. Her work encompasses photography, video, performance art, installation, and books with an eye towards social justice and cultural change. And she often uses collaborative storytelling to capture the voices and stories of individuals represented in her works. Toni Morrison said, "This is precisely the time when artists go to work. There is no time for despair, no place for self-pity, no need for silence, no room for fear. I can't think of any words that are more poignant to describe this work and its journey in the making, which you'll hear more about shortly." LaToya's installation, More Than Conquerors, a monument for community health workers of Baltimore, Maryland, 2021-2022, pays tribute to the heroic efforts of the frontline public health workers and professionals who offer guidance to people navigating this complex healthcare system. They are some of the most important yet under-acknowledged heroes of our community, and we're proud to have 18 community health workers of Baltimore recognized in our collection. Community health workers are also the first to recognize the consequences of environmental neglect on the well-being of the communities they serve, which is why this work was chosen to kick off the BMA's 110th anniversary celebration, and its Turn Again to the Earth initiative, exploring art and the environment across time and geography. We're very grateful to Gladstone Gallery for bringing this work to our attention, and especially to Glenstone Museum's Emily Rails. She gifted the work to the BMA collection last year, and we're also happy to see represented here Glenstone's Senior Director of Collections, Nora K. Fritz. The BMA is the perfect place for this compelling artwork about Baltimore's unsung heroes and sheroes, and we're deeply grateful for all of your support. The presentation and the fantastic digital guide that accompanies it was made possible by three very generous sponsors: Johns Hopkins University and Medicine, Care First Blue Cross Blue Shield, and John Meyerhoff and Linnell Sirachi Meyerhoff, and we thank them for their support as well. Last but far from least, because of her incredible body of work tackling industrialism, Rust Belt revitalization, environmental justice, access to clean water, access to health care, and human rights, LaToya is one of the 2 artists receiving an Artist Who Inspires Change Award at the BMA Ball and After Party on November 23rd. We look forward to honoring her at that event. And now I'm pleased to introduce Jessica Bell Brown. She's the former BMA curator and department head of contemporary art here at the BMA, and now she's executive director of the Institute for Contemporary Art at Virginia Commonwealth University in Richmond. Thank you, and please give them a hand.
Thank you so much, Angela. LaToya, what an immense privilege to share space with you today, this morning, and to all of you thank you for being here. Over the past several months, we've been working towards this moment, and it's finally here. So thank you so much. You are an activist, a storyteller, an advocate, whether it's documenting the most personal and most structural effects of environmental racism in your hometown of Braddock, to shedding light on the water crisis in Flint, Michigan, to highlighting the families of UAW workers impacted by the closure of the GM plant in Lordstown. As an artist, you've always committed yourself to telling the story of workers' thoughts and the experiences of navigating inequalities, but also their humanity and their dignity. And I would love for you to share with us, LaToya, as we open up the conversation this morning, how you decided to place your lens on the community health workers of Baltimore.
Sure. Good morning, everybody. How y'all doing out there? This is pretty awesome. This is the kind of moment that an artist lives for, to see a work of art that they've created for everyday Americans to actually be celebrated in their own local community, where their own local national museum is, where their families and coworkers and the people, the companies they work for can see them. So to try to sum up all the intricate parts of how this came to be, it was 2015 when I was invited here by the Contemporary and art organization in one of the Baltimore high schools, where Dr. Lisa Cooper and I were asked to come in for this panel discussion about how could doctors and scientists and artists make useful art. And so it was during that conversation that the seed was planted, because Dr. Cooper saw the notion of family, the work that I'm known for about my mother and grandmother living in the still town of Braddock, Pennsylvania, as you mentioned. She saw that work between me, my mother, and my grandmother as a component of photo voice, which is the methodology that doctors use with their clients to let them have the cameras and tell the story so that they could show that to policymakers and politicians to impact change. And so I never forgot that, and Dr. Cooper and I remained in touch for many years. And then I received the MacArthur Fellowship in 2015 that fall, and Dr. Cooper is also a MacArthur Fellow. And so what's interesting about this collaboration with Dr. Cooper and how this takes shape with this question that was put forth in 2015 here in Baltimore is that we would meet again in 2018 at a retreat in Chicago for the MacArthur Fellows. And there is where, during the retreat, it was doctors and scientists, filmmakers and photographers, we're all sitting in this circle. And then we had this beautiful conversation about scientists and researchers saying, well, we wish we could get our work to the general public. And I was just smiling, thinking about Dr. Cooper and I having that conversation and just realizing, well, artists are the best vehicle to do that, right? If you want to introduce it to a larger audience, and if you want to make it feel accessible to people, or how you take data and information in studies and then make it accessible to everyday people. So I was listening, and in all my work, I'm always empathetically listening and always thinking to how I can have a creative solution. And so fast forward to the pandemic, I experienced medical racism. I was denied the COVID vaccine on a site that I was told to go to. I have lupus, an autoimmune disorder. I was phase 1B, went to the location. Right before they were going to administer the shot into my arm, the manager of that site came up and racially profiled me and told me, you falsified your QR code, you shouldn't be here, and I was detained. And I never forgot what that looked like. I was looking at all of these black women sitting at these chairs and these desks administering the vaccine, but yet they're flanked and surrounded by the US military as well as law enforcement, and the manager of this site is a white man. And then here I am sitting there detained. And it was the first time I had ever come out of my home. And so I was very scared to sit at a site that long, exposed to people who still hadn't been vaccinated yet. That's dangerous if you have an autoimmune disorder. So fast forwarding from that incident, I didn't let it deter me. I went home, advocated for a different location, but then I called Dr. Cooper and I told her what happened. And immediately she said, you need to come to Baltimore. I want to introduce you to my mentees, Dr. Anika Hines and Dr. Chidima Ibe. And also, that is when, every time something bad happens to me, instead of feeling defeated, I just come up with a question. And so my question after experiencing that, I'm like, okay, I see Dr. Fauci on the news and Mayor Lori Lightfoot saying black people don't want to be vaccinated. Well, I just experienced the complete opposite, right? And I'm someone who has gone through all the proper channels of elite institutions, right? No MacArthur saved me from being racially profiled at that site, right? Awards don't protect you from discrimination, no matter who you are. I was just a black woman that they didn't think deserved access to the vaccine. So it became really important for me to place myself around Dr. Cooper and Dr. Ebay and Dr. Hines, and then they introduced me to Reverend Hickman as well, and then I also met Tiffany Scott, and that type of sisterhood and energy to help me push past a violation and being denied the vaccine allowed me to see the clarity and the answer to my question, which was, if someone like me could be denied the vaccine, and they're saying that black people don't want the vaccine, and I know that's not happening, who are the people in our communities that help us get access to it when we're in fear of going to these sites because we know we're going to face this discrimination? And so that was the question. And Dr. Cooper provided the answer, which was Dr. Chidima Ebay, who specializes in community health workers, and Dr. Anika Hines, who practices the methodology of photo voice, and Reverend Hickman, who runs STAR, Sisters Together and Reaching, here in Baltimore, who had already worked with Dr. Fauci during the HIV and AIDS crisis, who was already at the helm of mobilizing community health workers to roll out the COVID-19 vaccine across Baltimore. So that is what became the motivation. And on top of it, reading Dr. Cooper's book about why are health disparities everyone's problem, that is your homework assignment. If you don't have that book, you got to buy that book today. Because those are the answers. And so as a visual artist, it becomes my responsibility to make a visual artwork, a visual justice that really tackles all of those different layers I just laid out for you, right? How to get all of those doctors' research out into the public in a quick, compelling visual way, and then, of course, how to show who community health workers are, and the fact that during all of COVID-19, when they kept talking about essential workers, they never one time mentioned community health workers. And so I wanted to bring that visibility to the general public, and I think the best way to make work that can move people and get people to think and give them a place of reflection is through photography and storytelling, but then that added layer of the fact that it's not simply a suite of photographs and text, it's actually a 21st century workers monument.
That's an amazing segue, LaToya, to talking about the monument itself. I think the beauty of, one of many beauties about this work is that you are holding up a mirror to these networks of advocacy and support that is happening in Baltimore City, but I think also nationally and internationally, these sort of invisible, or invisible to the sort of wider public, but these critical voices who are amplifying all of these efforts to really challenge our status quo, create positive health outcomes to address disparity. But thinking about the monument itself, you are offering an incredible provocation and proposition through this work. And I think if folks haven't had a chance yet to experience the monument, it's on view now through March 23rd. And if you haven't gone in just yet, this is, I think, a really great moment to actually talk about what it is that you see when you experience this work. So starting with this idea that the photograph, and especially documentary photography, has always kind of had this challenging relationship to the subject. Your work offers a reversal of that. And I want you to kind of talk about some of the devices formally that we see in the work that allow for us to really see many new possibilities for images in the realm of visual justice.
Okay, it's beautiful. So perhaps I will point this out, and I'll get up so I can really point this all out to you. So what you see here is that this is, there's two fronts, right? It's double-sided. So when we think about social documentary work, we don't think about work that is standing on its own, occupying a space, being very sculptural and architectural and referencing spatial relationships. So the first thing I wanted to do for the viewer is to give you that experience of what that feels like when you are seeing a group of people, a network of people who provide care and mutual aid and love and protection to an entire city, what that feels like to walk amongst them. It's almost like I was thinking of all of them as an army of angels, but also as a real sisterhood and network. So by walking through the space, what is happening is we are also indoctrinating you and enlisting you to come into this type of network of mutual aid and care, and also people who are literally interceding for people's lives. One of the other things that I think slowly starts to come forward for people that is different when you think about black and white, matted frame social documentary work is that this is actually shot in color. What you also start to realize once you see past the mask and how slick it actually is that that's medical equipment. These are the intravenous IV pulse stands that are universal. So now I'm saying we all have a stake in this. We all know how to relate to this because we've all been in the hospitals with our loved ones, and we know that in addition to the ventilators that needed to be built and distributed and were being used to save people's lives who had COVID, one of the other things is making sure they are hydrated, that they have the nutrients. So finding a universal everyday equipment to then help ground it, and then on top of it, look at the spatial relationship. So even though we survived COVID and the piece is on view in 2022, by me designing it this way, taking the IV pole stands, I modified them so that they're held in these metal frames that I ordered and collected, then built out this whole armature on the IV pole stand that allows it to hold 4 vertical photographs. One is the portrait of the CHW, and the other one is their voice. And then on the reverse side, again, it's 2 fronts to me, not a front and a back. On the reverse side are photographs that are made by anonymous community health workers who I taught how to make photographs and take pictures across the city of Baltimore. So these are amateur anonymous CHWs who are participating in Dr. Chidima Ibe's IRB review, approved study at Hopkins, deploying photo voice. So I would meet with them online to teach them. We used the work from Flint, the notion of family, so they understood how to make portraits and how to reconceptualize a self-portrait when you have to remain anonymous. By elevating their beginning photography works and their text on the same level as my own portraits, right, someone who's approved by the elite institutions, putting my work next to someone who's a beginning photographer that I just taught, and some just made these photographs the first time, mounting them this way, sharing that same space, is democratizing the arts. Mm-hmm. I'm saying that everyday people also make images and contextualize and author and own and tell their own stories. And additionally, they are literally showing you one portrait at a time and text at a time what social determinants of health are. The other thing that you start to notice is that these are what the CDC guidelines are. They're social distance. So by you walking into the monument and starting to walk amongst it, to read these stories, to hear what they have to say, to learn about empathy, to learn about compassion, to learn about their work, you have to do it at social distance space. Also, I see this as a place for people to go for contemplation and reflection, because one of the things that made me concerned about the condition of us as a society is that as soon as we got the vaccine, they opened up and said, you got to go back to work. So we didn't really have an opportunity to grieve or to mourn or to process what it meant to lose millions of people around the world, as well as all the hundreds of thousands of people we lost in this country due to the way that our government handled it. So when you're in here, if you never had the opportunity to grieve or to process it, the way that I interviewed the CHWs was also a way for you to come in and read what they're saying and relate to it so that you get that moment to pause and grieve if you lost someone. So it also functions as a healing space, as well as a place of being able to contemplate well, why aren't we recognizing, how CHWs refer to themselves as the foot soldiers of our healthcare system? Like, why don't we even recognize them this way? So this is why it became important to situate it. So it really is a work of art. It's not simply photography. So you have to really, this is about experiencing it. And often my work requires, if you're going to engage with it so that it's not objectifying and exploitative, it requires emotional and physical exchange from you as the viewer. So you don't get to consume these stories and consume what they went through freely without giving something of yourself. So that's why they become larger and larger and more complicated. These poles, ivy poles, are 9 feet tall, so you feel the power. They're in one accord, they're in unison, but it truly is this army of angels, and it's why I titled it More Than Conquerors, which is based on Romans chapter 8 from the Bible, about how literally we're being put to death every day of our life, right? Through systemic and institutional racism, through spatial racism, through gentrification, through redlining, through all the issues around social determinants of health, not having access to clean water, not having access to grocery stores, not being able to make decisions about our bodies and our health. And then, of course, what we see now, which makes this even more prophetic in terms of what the CHWs are saying, what just took place, is exactly why a monument like this needs to exist for the general public.
Precisely. I am so struck by, a recurring, I think, device in your work, but also device, formal strategy, principle, is the use of story and narrative. And we refer to the interviews as testimonies.
Yes.
And there's something really beautiful about reframing narrative as testimony that sort of seeds power, agency back to those who are being depicted. I want to kind of move into some other images so you can see, for those of you who have not been able to step into the installation just yet.
Even the wheels are all the same way, and it's bolted into the floor. Like, I am meticulously making it uniform, unified, and very powerful in terms of its stance. So even down to the wheels, I go in and make sure they're all turned just so the exact right way, measuring that social distance, thinking about how you're moving through it. You can move through it how you want. There are certain people who have relationships with each other, whose narratives are around each other as well. And what I'll say to touch on story, so I want to take you into behind the scenes. So when I arrived here, in order to understand how to see Baltimore, I worked closely with Tiffany Scott, the great Tiffany Scott, the first community health worker of Maryland.
Pictured here behind us.
There is the great Tiffany Scott. And so Tiffany took me on a 3-hour tour all across Baltimore so that I could understand all the locations, all the sites. What's the difference between somebody who's from East Baltimore and West Baltimore? Made sure that I started to really understand it. So what I'm also saying is, as an image maker, as a photographer, I have to learn to see through somebody else's eyes. But the only way to know that and know how to navigate and move through a space is to actually do a deep dive into their personal histories and their stories and their traumas, but also their triumph and how they are showing up in these spaces due to everything that they've overcome. So to do it, I interviewed all of them for 3 hours first. And what Tiffany did after she gave me the tour and we had all our calls, she set up a Google Doc. I deployed myself with all my cameras and recorders and equipment here to Baltimore. I had just got my vaccine finally, and I deployed myself here the summer of 21. It was July and August is when I got on the ground to join them at the front lines. So I would sit in the Revival Hotel overlooking the George Washington Monument, waiting, hitting the refresh button, seeing when the CHWs would fill out the date, the time, and the location where to meet them. So it was like my hotel room became like a dispatch as a photographer. And so whenever it would pop up or if someone would text or call, I would grab my gear and I would go out into the city and meet them where they are, which is also a beautiful line from CHWs. Nothing about us without us, and you meet people where they are, is what they taught me. So The 3-hour interview would happen first out of sight. I remember with Will, I interviewed him in his car for 3 hours, for example. Then, based on that interview and the details, we would then choose, they would choose a location where they wanted to be photographed. So, you know, in Will's case, this is his grandfather, right? The park is named after his grandfather. He spent a lot of time talking to me about his family's history and his grandfather's activism with Philip A. Randolph. And so my work, being from a still town, has always been preoccupied and concerned about teaching Americans, in order to understand neoliberal capitalism in this country, you would have to acknowledge that black people, due to slavery, right, this country's economy exists off of our free labor. And to update that into the 21st century, you would have to engage with people who understand what racial capitalism is, and also what civic engagement means and how that is intertwined with civil rights. And so Will's testimony in my interview with him becomes the way to talk about that, to create a visual lexicon for it today. What better way than photographing him in a monumental way? Because my other obsession is, being from Andrew Carnegie's town, where his first steel mill is and where everything is about him, I've always been obsessed with, if we can make statues for industrial capitalists, then surely we can make statues for everyday Americans who made them profitable and wealthy. And so what you actually see me doing is doing this through portraiture, but it's really about history, and it's really about monumentalizing them as if they were statues themselves at these locations. But this concept of a monument of solidarity, which was the title of the MoMA show, is really about saying it's not the image of a singular man. It's really about the act of love and the way people show up for people in times of deep sorrow, and especially when those people cannot do anything for you. And I think this is why I have this idea of a museum of workers' thoughts, of creating monuments of solidarity, of touching on people like Donnie Missouri as well. If you notice, in order for me to capture this image, I am really crouching down quite low with a medium format camera that doesn't have a prism on it, so it allows me to look in the ground glass of the camera, because it's a waist level camera. And that's what allows me to get these very precise shots. But then of course I have to walk up to him and meter him, because you only get 10 shots. It's medium format film, which is 120 film. It gives you that nice quality that allows the detail for them to be enlarged. But if you look at this image, by photographing him in Patterson Park, it's also knowing the histories of these sites. These sites are also places where battles were fought. These are sites where they are commemorating generals. These are sites where they're commemorating people who were slave owners and colonial powerful figures. It's not meant to see Donnie Missouri standing here in this beautiful pink Black Lives Matter t-shirt. And you see, I got him to stand a few different ways, because I know what I'm doing when I'm looking at them is I'm going through all the history of art. I'm thinking about all the time I've spent in Rome, all the time I've looked at Greco-Roman architecture and sculpture, everything I've looked at with Bernini sculptures, with Caravaggio paintings. Like, when I'm looking at them, they don't know that, but that's what I'm doing. I'm going through all of those historical stances, kind of dissecting art history and dissecting photo history to make these type of powerful images, even waiting for that wind to come through just enough so that his mask just kind of curves along with his body. And you see the same thing in Tiffany Scott's portrait as well. I'm waiting for the golden light to pop up, because we're out there, I think, at like 5 in the morning, 6:30 in the morning. I'm waiting for that golden sunlight to hit. It hadn't come yet. And what you don't realize, and what Tiffany wasn't aware of that I was doing after listening to her testimony and knowing her story, if you look, her head is situated perfectly between two buildings. What are those two buildings called? What corporations are those?
World Trade Center here.
Transamerica and Bank of America. What do we know about black people's relationships to these institutions? But yet, here Tiffany is standing with that powerful, defiant, angelic stance, very in control and aware of her body, as that golden sunlight starts to rake across her body and her skin, and that wind picks up where it again like those Bernini sculptures and Caravaggio paintings, you start to see that wind activate that space around her. And the other thing is, where I'm standing, knelt down low, photographing her, a general's bust is staring at me and us. So there is a relationship that I'm setting up where, in some ways, they would say you're, decolonizing that space, but also recognizing that here with Dr. Cooper, let's go to Dr. Cooper. When I asked Dr. Cooper where she wanted to be photographed, she chose the Inner Harbor. And we kept walking along the Inner Harbor, and then I was like, I gotta get it with the Dominion, the Domino Sugar Factory. Why? Because of its also colonial history.
Yeah.
And also photographing her in the Inner Harbor. Well, who came through the Inner Harbor?
We did.
Slaves, goods,
Our ancestors did.
all of that. So I walk through these spaces even after I photographed them and after they picked these locations to understand even Dr. Cooper is a visual symbol herself because she's dressed in her attire as being a Liberian African. Right? So look at the textile, look at the color. That is a symbol and a representation of her culture, her heritage, her legacy. So by seeing her body situated to that river in the Inner Harbor in that factory, I am showing you, right, that power of contesting these histories and pushing us forward through all of these Black bodies, as well as African bodies, as well as Afro-Latino bodies. And this also breaks through this notion of me being an artist that only makes photographs about Black people. And that's not necessarily true. My work is actually about class. And it's about dissecting social caste systems. And it's about breaking through these types of hierarchies that exist. But the only way to do that is to create a multitude of portraits in a very diverse range of people. But the power is in how, even when I showed up to meet with Evelyn Nicholson, we were originally going to meet at the IHOP. So when I hit my refresh button, we were going to meet there. And we got there and we realized it was too noisy. And so we took the bus together. And I realized, she's like, well, we can go over to where I work. And it was at the University of Maryland. In the
Institute for Human Virology, where she worked
yes.
as a community health worker.
And she's wearing her Jocks t-shirt, which is a program that she works at, and it's created for around her activism and how she's engaging with people with HIV and AIDS at this program in this location. And so for me, what I'm also intentionally doing is photographing her right outside, so all the doctors that are coming through, they see her, right, being honored, being recognized. And I interviewed her at this site as well. So that is intentional in terms of the dynamics or how I reframe how someone is seen or perceived in their community and how they feel when they suddenly realize they're being monumentalized at their workplace, but not having really thought the tremendous energy and labor and how much they really deserve to be situated and seen at this higher level. So, I'm just obsessed with a paradigm shift. I'm obsessed with saying, if Franklin Delano Roosevelt and Roy Stryker, who was the head of the Farm Security Administration in the WPA in the 1930s, if a president and someone that's the head of a photo organization like that can deploy photographers to go out into the South in this country to make portraits that say that a president's policies were important, but yet control how they're contextualized and how they're proliferated years after, then I have to subvert that for people in the 21st century.
Absolutely.
And that's what you see me doing, saying they are the ones who are creating the authorship, their voices are what are contextualizing it, they're dressing and representing and presenting themselves the way they want to be seen and known, and they are determining how these are being disseminated through these types of institutions where work like this has a stage to be shown. And so I just keep doing a subversion of that and a paradigm shift, and then building out more and more and more voices, because it's not about me, it's about creating this beautiful, harmonious choir of people that is such a rich, diverse range. and the fact that it is a story of triumph. But in order to know the triumph, you have to know all of the trials and tribulations that they went through.
And why they're conquerors, right?
Yes, they're truly unsung heroes. So these stories, I asked them, where does your empathy come from? Where is your family from? Where are all the different neighborhoods your family lived in? Where do you live today? Where are all the places that you work? Where are some of the patients and clients that you serve? Where do they work? And
What does it mean to be a CHW?
Yeah, how do you define it? And like in LaTish Walker's portrait, what was really key was showing her standing in East Baltimore on her stoop of her apartment, because what does it do? By doing that, it is showing the demarcation line that we don't think about. And this is something LaTish really breaks down really well, because the day I made this portrait is the day that LaTish is walking interns from Johns Hopkins who are going to become doctors, walking them from Hopkins on a 90-something degree day, right, high noon, and walking them from Johns Hopkins to her front door so that these doctors can feel what it feels like to walk outside when it's hot like this. Say your appointment is about to start. Like, I learned from them that if people are late, they lose their appointments. Well, when you get there, you don't understand what entrance is the right entrance. There's multiple street names, plus you're hot, you're thirsty, you're tired, and the hospital itself is very enormous once you finally figure out where to go inside. So it became really crucial to photograph LaTish doing these walks with these interns so that you can see as the viewer really the true unsung hero that she is. She's like the Harriet Tubman and the Nat Turner of East Baltimore, because who else would be able to brave going through the demarcation and the gentrification? Right, she helped me see, right, the cracks in the pavement, the types of things that would be on the ground, but then when you start approaching Hopkins, you see the blue lights. The sidewalk is paved evenly, the streets are clean, and I'm seeing more and more of that even around here in the museum. So
LaToya, we have to end here, because I know folks want to get folks to that last seating, but I want to, maybe as we look at this image together, if you can share with us what you want folks to walk away from when they experience this work, this monument.
So this is it right here. To understand that it is someone like LaTish who, by taking the time to walk people through her community that have their own implicit bias, I need water, their own racist stereotypes about her community, about her family, and about her, right? Being brave enough to go behind those institutional walls and be in a role that people don't even recognize or value. It's actually the great contribution of love and power, because what happens to these interns after they experience someone like LaTish, they never see the world the same again. And I distinctly remember from this walk that these doctors, because I was listening to the questions they were asking her, and I interviewed her in her office at the hospital as well in order to then go and make this portrait. One of the things that stood out to me is that these interns knew that they had used prejudice and implicit bias when taking notes on patients. And because they had this experience of walking in this type of environment and condition, after encountering LaTish, they went back and changed their notes, right? They didn't see these patients the same way. They didn't describe or use the type of discriminatory implicit bias that folks use when talking about people from Baltimore, right? They had to change their whole way of thinking. So that is what's important, because that literally is saving someone's life, right? A doctor can accidentally cause harm and death to someone because they're not aware of how they've been shaped to think about race, class, gender, citizenship, different levels of poverty and access to a different type of income, or the conditions that are causing them to miss these appointments, these conditions that are causing them to live at home in a particular manner that isn't good for their mental health. So, they are literally intercessors saving people's life. And I think it's not simply care work. This is also the spiritual work that is being done. And that's why we should be honoring community health workers who really have put their lives on the line every day to fight a system that still to this day doesn't want to acknowledge them. I mean, looking at someone like Kamala Harris run an incredible campaign the way that she did, and to see the outcome, what that tells me as a Black woman in America that just went through making these images of Black men and women across the city of Baltimore dealing with these issues that we know are created by institutions and system, what that tells me is the country doesn't trust Black women. And yet, Black women are the ones that are the lifeline and the caretakers of this nation, of this society. And so,
Yes. That part.
for me, it becomes so important to create a monument for community health workers in Baltimore at their National Museum that is a counter to all these other monuments to singular men, so that people understand they should be celebrated while they're here, while they are alive. We should be thanking them for their public service. We should be thanking them for all the ways they have showed up for us. And I'm not going to wait for the permission. I'm just going to keep using my creative gifts to create these 21st century worker monuments that are celebrating the men and women that actually are doing the real care work and saving people's lives, whether this country wants to recognize them or not, whether people who are voting against their own interests recognize it or not. And the crazy part is we're going to need CHWs more now than ever because of the new policies that will come out of the misunderstanding of what really is at stake. And so these things come full circle, and I don't want any of you to forget, like, women birth our civilization. Women birth our workforce. Women are the ones that are living in the industrial heartland of America, taking care of people who have retired from the steel mills, the coal mines, the auto industries. Like, those are women taking care of their loved ones in their home. Those were women who were there checking on people, taking care of them when they were dying in elder care, or when they were dying during the pandemic, or when people were living in fear. So I think that there isn't a real way to measure the work that all of them that they're actually doing, which is that transformative spiritual love that they are imbuing on people that really is the sustenance that is extending our civilization and our life. So I think it's important to spend time in this monument. It is designed for you to come in and read the testimonies, maybe one or two at a time. The 3-hour interviews are edited, so it will take you, whether you read slow, fast, or medium, it'll take you about 15 to 20 minutes to read each testimony. That is the length of a doctor's appointment in this country. So you are not supposed to try to consume the whole monument in one visit. You are like you would make visitations to your doctor's appointment. You make the appointment and you come back and you read each testimony. And the last thing I'll say is I'm glad that the museum was able to do the component that I couldn't do by myself, which is the audio of hearing their voices. So there's this added layer, and this is why it's important to work with local communities that understand the humanity of the work that I'm trying to do. I want to thank the museum for taking the time to have all the CHWs come back and read their testimony, so that now all of you, when you're in the space, you can scan the QR code while standing in the space, and you click the picture that you're standing in front of, and you can hear Letitia's voice, you can hear Tiffany's voice, you can hear Reverend Hickman's voice while you're standing in front of it looking at their portrait and the testimony. Also, you'll see that they took the time to create a map to show all the locations that I went to all across Baltimore to make the portraits at the exact location. Why is this important? It's the counter. So the photographs are also about geography and mapping. It's about not being able to erase Black people from the landscape and saying they aren't there or were never there. And it is the counter to what I learned from Dr. Chidima Ibe in the book that's actually in front of the monument before you go in the room, about this butterfly effect across Baltimore, which is part of that segregation and redlining, that it's created this shape. So when you walk in there and you see the map, you actually do start to notice that these black marks on the map actually illustrate this. So it's also about being able to visualize all of those things at play and how their work disrupts, again, the thing that is most important, which is the historical erasure of our existence. Me writing it large for you to see, because what it actually does is it is the indictment on the system that continues to try to erase and kill people who have a right to be here and contribute to the lifeblood of our community.
What an incredible counter that you've offered us through this work, LaToya. Thank you so much for being here. It's truly an honor.
Thank you.
And if you are, please join me in thanking LaToya. And please join me in thanking all of the CHWs who are represented in this work. So I would love everyone to sit down except for our CHWs so that you can acknowledge them.
Yeah, so there's Vita, there's Donnie Missouri, there's Latish Walker, there's Tracy, Reverend Hickman, I see Kendra. Yeah.
Thank you.
There's Tiffany Scott, there's Erica Hamlet, there's Helen Awanda, Griselda Fun. Is that Will? Is that Will Torriente? Oh no, that's Rogers.
Will Rogers.
Yeah, hey. So really, it's a tribute to them, truly. So make sure that you talk to them, walk up to them, thank them for their service, ask them about the work that they're doing today, because if this monument wasn't here, the other thing that I want you to walk away and think about, you would have never knew that they did all of this work.
You see a CHW, thank a CHW. Thank you, everyone. Please enjoy brunch. And please make your way to the exhibition upstairs when you have a moment today.